Hello, everyone, and welcome back to Reclaiming Fertility Joy, Healing the Broken Spirit of Polycystic Ovarian Syndrome. I am your host, Corey Ray Kovacs, registered nurse and women's wellness mentor and educator. And I am joined today by Dr. Danica Thornberry. She is an amazing person that I have gotten to know and had wonderful, amazing conversation with recently. And I'd love to kind of share a little bit about Dr. Thornberry. She is a fertility-focused acupuncturist who received a research doctorate when she tested the concepts inside Seed Fertility in a clinical intervention pilot study to confirm the program's efficacy. During 2001, since 2001, she's helped thousands of fertility patients become mothers. She's worked alongside Los Angeles' best fertility specialist, appeared on Lifetime TV's Speaking of Women's Health, and she's received the award of Excellence in Family Building from Resolve. As a mother of two against the odds kids herself, Danica created the Seed Fertility Program to offer women effective tools to recover their lost fertile confidence and increase their chance of healthy full-term pregnancy. Well, welcome, Dr. Danica. I was so happy to have you here today.
Thank you, Corey Ray. I'm really excited to talk to you and your audience. This is going to be fun since we're both from Indiana.
Yes, I mean, it's just amazing. Like every time we talk, there's something that we find that we're passionate about or that we have in common. Both being Midwest ladies is definitely one of them. And I'm glad to Hoosier represent here.
Cool.
So I would love to hear a little bit more about your Seed Fertility Program. I know that you founded it in 2010, and you've really kind of become this amazing trailblazer in the fertility landscape because of your kind of methodology in approaching the whole person and in their fertility journey. So I would love to hear a little bit more about your mission and how you've been supporting women through this program.
Okay. Well, I think like most people that are passionate about things, it started from my own personal journey, that diagnosis of infertility and premature ovarian failure when I was 31 years old. And being told that, but being somebody who works in the holistic field as an acupuncturist, and I had already helped so many other women, there was this feeling like, well, you can't write me off just yet. And I've got holistic medicine and a full toolbox, and I'm going to be working on myself. But while I was working on myself, I wasn't with a partner. So everything that I practiced and learned, I had to apply that, or I got the chance to apply it to the patients that I had in my clinic.
Mm-hmm.
The more that I applied that to their cases, the more women became pregnant. And that gave me a sense of this thing called fertile confidence, where it was like, okay, if we change the mindset, if we tweak the diet and align it with the menstrual cycle, then the hormones will behave differently and the mindset's a little bit more predictable. So from there, and after helping like 2,000 different women plus my own story, I started talking more seriously about teaching. And it was a bittersweet opportunity when one of the doctors I worked the closest with, who had a psych background, ended up passing away. And when she did, I went to the other doctors in the practice and I said, I think I need to teach and dedicate this to her. And they were very open to that. And that's how the Seed program was born. And it was a live workshop where I would roll in with a cart that was full of fertile foods, handouts about the recipes and affirmations for fertile thoughts. And the women responded really well to it. And they became pregnant from attending these classes somewhere around like the 4 to 6 months mark after attending. Then I ran out of energy and simultaneously got excited about online. And in 2013, it was the first online fertility class to launch onto the internet. And it was great because then the success rate moved faster, whereby like at 2-month mark, pregnancies were coming back. We have a tracking device inside the course.
Wow.
It asks the women, if it works for you, would you please click this button and let us know, and then we'll send you some more free guidance. So we were able to hear back how it was working faster. And I think it was because the women had access to the guidance like in their
Mhm.
laptops and phones, and they could take it to the grocery store. They could work on it in their homes. They could rewatch the
Mm.
movies. And so they really became empowered. And I'm just very proud of them for taking a chance
Yeah.
on me. This little online course that was out there, and they found it.
Well, it
Have a
really is revolutionary what you're talking about.
Thank you.
And
Thank you. It's really women power, right? It's
it
if
is.
women are given some tools and they resonate with them,
Mhm.
then it has the power to change them because they make the decision that they're going to change.
I think it's interesting because I had recognized this kind of post, this concept of mindset and how much, through my own personal journey, seeing how much that would have made a difference back then. And
Mhm.
just in the whole process of, I had built so many walls of feelings of brokenness, and I didn't trust my body, and that stuck around for so long and had impacts significantly afterwards. And it wasn't until I started doing, self transformation work and kind of discovered that myself through that. But it like applying this concept to helping women who are going through the fertility process while they're in it is it truly is marrying the best
Oh,
parts.
yeah. Well, that's really well put, and it's so true, and that's not easy to market
No,
that.
it's
Hey,
not.
hey, let's change you while you're doing the scariest thing ever. But it's kind of common sense and really important to talk like that,
it it
to
is.
at least like throw it out there, and then the right ones are going to hear that and they'll say, "Oh
Yes.
yeah, actually, we've done it this way so many times and nothing
Mhm,
is changing. I guess I have to start. I got to take care of business now."
mhm. Well, it does, it's amazing how when you kind of open up yourself to having this conversation with your, how you connect to divinity or to even your body. Like I know just even opening that and rebuilding that relationship of trust has opened. I mean, it's amazing how much different my cycles had changed over the last 3 years since I started that process. Like my cycles got more regular. I'm more in tuned. I know that when my stress is up, that I need to take care of myself, or when I'm not supporting myself, like I can see those things now where I couldn't do that before. And that's,
Mhm.
teaching that to others is really important, and giving them the tools before they have, bring children into the mix is, I mean, they're going
Right.
to need these are tools that you're going to be able to use now and for the rest of your
Mhm.
life. I mean, that's
Right. I have an interesting example where one of the women in the Seed program used the tools. She conceived via donor eggs as twins. And
mm,
um, I heard from her when the twins were about 7 or 8 years old that the father had terminal brain cancer. And she shocked the heck out of me when she said, "Thank goodness for the Seed program." And I was like, "What do you mean?" And she said, "Because without those tools, I don't know how I would be getting through this grieving process." Like that
mm,
really gave me some tools for surviving challenging times. And I mean, like, doesn't that speak to, because we could say parenting is hard and you need these tools, but she was saying life is hard
mhm,
sometimes as we get older, and the stuff that we are presented with is intense. But with a toolbox of tools, you have perspective that you might not
mhm,
have if you hadn't gone through infertility and transformed along the way.
mhm,
Because it's like it's great when it works, but it's super great when it works and you really like yourself and your marriage is stronger, right?
mhm. Absolutely. I mean, you mentioned the word grief, and there is so much grief that occurs through this. You grieve how you thought your life was going to be, how you thought you were going to get pregnant. You grieve your health. If you get diagnosed with PCOS through the fertility process, like so many of us do, or if you experience pregnancy loss, or just the challenges, if the grief that you experience when medications don't work, or when an IVF retrieval fails, or implantation. I mean, all of these things, these are mountains of grief. And so having
Mhm.
these tools to process this now does really set you up for future, for
Life,
you. Yes,
right?
for life, because
Mhm.
there is grief. There is grief. There's
Mhm.
always challenges. And
Right. When I was 26, I hooked up with the therapist who I still see, and she's in the valley here in California, in
Mhm,
Calabasas. Her name is Debbie Frankel, and
mhm,
she is at the Grief Recovery Institute
mhm,
training. She taught me one very important premise, and is that loss is defined as the change from the familiar. And so
mm.
getting married can be a loss of your
Yeah.
freedom, right? So we are all grieving something. And as
Mhm.
we learn how to reconcile loss, AKA adjust to change,
Right.
then
Yeah.
we can be more prepared to flow through life. But in this specific conversation with respect to infertility and PCOS,
Mhm.
it's repeated
Yes.
disappointment
Mhm.
month after month, whether you're cycling, maybe you're not even having a period. And
Mhm.
so it's the loss of that reproductive ability, the
Mhm.
loss of the dream. Like you said, you really did a good job of going down the list of the different losses that women are presented with and that they need to acknowledge.
Yeah.
You know, I spoke today for 90 minutes on a Zoom with another patient, and she's gone through a very long history. And I think today, when we talked, she's like ready to do some of the internal work after 3 years,
Mm.
right?
Everybody,
So
yeah,
no
you have to
kicking and
meet
screaming sometimes.
people where they're at and realize that every single one of us is going to be at a different point. And, so recognizing that and saying, maybe those things are too much to deal with right now, right? It's like there's a saying we used to say, I don't know if it was just a military thing or not, but it's like, how do you eat an elephant? Well, you eat him one bite at a time. I don't know where that
Uh-huh.
came from. It's kind of
Uh-huh.
silly and weird,
Uh-huh.
but it's
Yeah.
true. It's sometimes that grief can feel so mountainous. It can feel so big, and sometimes you do just kind of have to take one bit at a time, and
Yeah.
sometimes those bits are going to be bigger, sometimes they're going to be so small. And so understanding that, and one of the things I help show people is like doing that with your cycle and seeing how your cycle gives you the power to be able to do that. And that's a really interesting thing that I've discovered, is like that part is like harnessing how your cycle works and the energy that's inside of that to do that. So like, no matter where you're at, in your fertility journey and or beyond, that you have the ability, and there are tools here to help you with that, and to understand that you're processing those on your own at your own pace, and to be gentle with yourself while you're doing that.
Yeah. Especially if you have PCOS and you're not
Yeah.
having a cycle,
Yeah. I
then
mean,
then you're really in a state of suspended animation and not really
kind of.
sure what to
Hmm.
do.
Yeah.
Very
And
stuck feeling.
it can mess with your mind. It can mess with your heart. It can mess with everything. And just this feeling of not being able to, oh, am I a woman enough? Or am I even worthy of feeling loved? Am I even worthy of being in this relationship? Or am I even worthy of becoming a mother? Like, these things, you ask yourself these things while you're in
Sure.
that kind of spot, this like
Yeah.
suspended spot, like you said, suspended animation.
Mhm. I think it might be a good place here for me to explain when I have a PCO patient in front of me and
Please.
with respect to the energy that's going on with PCO, because we know it might be a metabolic issue, it might be a blood
Hmm.
sugar issue, but it's for sure um, several follicles that are in the
Hmm.
secondary stage and they're not responding. The LH is surging, estrogen may or may not be high,
Hmm.
but the ability to rupture beyond
Hmm.
to properly ovulate is missing or hindered somehow. And so, from an energetic standpoint, I like to explain to the patients that this is a matter of blocked creativity
Hmm.
and or driving with gas pedal and the brake simultaneously. So there's like, I'm excited about all these ideas, but I'm too afraid to do it. Or I used to be a creative artist, but I've stopped it for fertility or something. But there's always something like that that's like holding you back. And I want women who are listening, if they do struggle with polycystic ovaries, and that's a spectrum, right? You can be classic PCO, you can be atypical, you can be skinny PCO. All of it's suggesting that something is preventing forward movement. And it's important to ask, like, on a creative, energetic level, is it me? Is it something that I want to do, but I'm not, and I'm not honoring that in myself? Or like, I want to be on a healthy diet where I'm not having so much sugar, but then I get anxious and then I go and have some kind of pastry or something like that. Like, where are we sabotaging ourselves when we're trying to move forward, but we're like stopping it somehow, right? So
it's so fascinating. What you're talking about is so cool.
different ways of looking at it. Yeah.
Well, and I think that we get so caught up, right? We are bodies, of course. There are systems and processes that we have in our bodies that are working, but there's multiple layers here. And I feel that the more that we start to look at these multifacets of ourselves, then the more we can get a better picture of how we can shift things to make forward movement. I think it's so interesting that you talked about that piece of what's holding you back.
Sure, because what you just described, a different way, in your way, is to say holistic approach, right?
Yeah.
Because it's holistic has this connotation of like, oh, I'm doing yoga, oh, I'm sprinkling some incense, I'm doing foo-foo medicine, but it's actually really taking a comprehensive view instead of focusing only on the egg cell or a lab test.
Right. Which those are important pieces of the information, but you really do have to look at the whole person and understand that we are highly complex, and also at the same time there are commonalities and threads that go through us. Like literally, while you were saying that about the foot on the gas or the pedal and the held back creativity, like literally I'm sitting here and I'm like, yes, that's exactly, like I understood. That's what happened to me when I was in the military. I was literally living in my masculine. I wasn't allowed to show anything of my creativity. Very linear, very, and I had to do that in order to do my job and to be an effective leader, unfortunately. And so
and so there you are, kind of stuck in a hyperandrogen profession.
Exactly. It's exactly
and so
right.
You're sending your pituitary that message of, we don't ovulate, we task master.
Yes.
We get done, we execute, do things.
Yeah. And I was extremely creative as a teenager. I was going to art school, and I was a performer. I was a singer. I was a dancer. I did all these things that was super creative and expressive. And then boom, shift into the military, and all of that changed. And it took me almost a decade to get that part of me back. And it's so funny. Once I did, guess what? My cycles and everything happened. Yes. And it's not, I don't see these things as coincidences. I can't, because it's too much, because I now feel like this being, and it's not that it's all about me. It's just like, it's so interesting that you're talking about this. And what I want to share this message with those of you that are out here listening is that there may be parts of you that have been pushed aside, set aside, pushed down, and your expression, your creativity, whatever that is, that those parts, and you may have done that for survival reasons, right? For work, or for even just to kind of belong in your group or what, right? There's so many reasons why we push those parts of us down.
And one reason I don't want to get left out is, once you're in treatment for fertility, have several appointments to go to, or the cost of those things, the appointments and the care may prohibit you from doing more travel or enjoying other things you typically used to do. It takes time to drive across town for a scan 3 times a week or something like that. And so it's like, okay, I can't do my writing or painting or whatever. or cooking is a creative thing,
Mhm.
and we have time constraints, or we're tired after work or whatever, and so then we're having processed food instead of creating a meal.
Mhm.
There's so many subversive ways that we kind
Mhm.
of affect our creativity in a way that we wouldn't even expect.
Right. And it's I think this expression part really does bring we get so caught up in our mindset, in fertility, we get stuck in our heads. We get so stuck up here and we forget to be down here. Like living
Right.
through our bodies, living through our senses, living through our experience, our joy, our pleasure, our, just enjoyment of life. And
Mm.
that's where that creativity and pleasure and expression it all comes from. And it's not it so shifting into that space where we're now bringing it out of here, bringing it more into ourselves helps. It helps in so many ways, and obviously we can't like say for sure why, like it's but it does work. I mean, you've seen it with your patients time and time again.
Yeah, I would call it self-regulation.
Hey, I love
the
that.
ability the ability to self-regulate, right? So when you start having a thought of it's never going to work, or I've
Mhm.
lost hope, or why should I even try, or
Mhm.
it just doesn't work in me, or something like that, you hear that and then you regulate and adjust the thinking to come back to,
Mhm.
well, actually there's a lot of different outcomes,
Mhm.
or there might be something that I haven't tried, or maybe it is time for me to invest myself emotionally, or maybe it's
Mhm.
time to make some kind of changes. I like to tell the patients that I work with, the more changes that are incorporated
Mhm.
into the scenario, is the more you will change on the outcome. So
Mhm.
when you're going through another cycle, then I say, like, okay, look at all these things that you've learned and changed. So couldn't we expect a different outcome this time? And
Mhm.
it's something seemingly so foreign to them, but then it actually kind of makes sense, and they give themselves a little more permission to have a different outcome, or to open their mind, crack it open just a little bit more.
I think one of these things, speaking of cracking open, we had kind of talked about this before about how kind of being vulnerable or being open about our story is really one of those pieces that you
Mhm.
encourage your clients to do is to open up and share your story and how powerful that is. How have you seen that in your practice with the women that you've worked with, in terms of how that's kind of helped them in through their fertility journey?
Sure. Great question. Since my book is called Stick It To Me, Baby,
Hmm.
it's a compilation of 33 stories, and those stories are amalgams of other women. Like, I started noticing, oh, they need to trust the process. And I was able to make a connection. Like, here's 10 women here's the different ways that not being able to trust plays out in their journey.
Hmm.
And then here's 10 really fearful women, and 10 angry women, and 10 women that are anxious all the time. And so,
Mm.
like, these amalgams. And then I put these stories into the book, starting with the concept of here's how it shows up, and here's what it looks like, and some kind of like solution, and then a story. And every woman, if she picks up the book, she looks like she can see herself in each of the 33 chapters. So I have an advantage based on my experience and having
Mhm.
created that book, that women know that I'm going to be helping them look for, or declare, or kind of start
Mhm.
to create their story and define what it is for them. And so it can be like, I could just said goodbye to a woman earlier this morning who I helped her get her first baby, and she was a
Mhm.
breast cancer survivor.
Oh,
And
wow.
um, and there are some frozen embryos that are on ice, and one of them is unaffected by the BRCA gene, and it's a
Mm.
girl.
Oh.
And the child she has is a boy. And because I've worked with this woman for a while, and they're not putting these embryos in, they're doing IUIs, because
Mhm.
um, those are younger embryos frozen in the ice still. And I think it feels like too final. If they pull those ones from the freezer and they don't work, then it really feels
Mm.
like that is the end, right?
Mm-hmm.
But because I have known her for this long, like we go back pre-quarantine with an intermission in between, I was
Mm-hmm.
able to say, like, I hope that one day that the girl does come out of the freezer, because it would be really cute to see some mini version of you, and I'd like to
Mm-hmm.
meet her. And that's me kind of like saying, like, let's bring the courage up without saying, let's face fear and
Right.
be brave. It's a way that will be like in her head, like,
You're kind
huh.
of planting the seed.
Yeah, and kind of saying to her, well, she might be thinking later in her mind, like, Danica thinks that there's a girl coming, and that might give her permission to start talking
Mm-hmm.
to the husband, like, or maybe to open up her mind with her doctor to do the mock cycle and the preparation of her uterus that she ideally wouldn't have to do if an IUI worked, but that might be something that's necessary to
Mm-hmm.
create that second baby. So right there is a story, and anybody that's listening can be thinking, what's my story, or
Mm-hmm.
something like that, right? And my story was, well, I'm not going to let the medical professionals be right about my outcome. And then there was an acupuncturist who was like, oh, I wish you had started working with me before all of this, as if my fertility was hinged on his needles. So
Ah.
like, well, what do I believe? I believe that nothing's really been easy for me, but I don't ever
Mhm.
give up on anything. So why would I give up on this? And that's how I have
Absolutely.
these two kids against the odds, right? In a
Yeah.
very unconventional way with an ex-boyfriend. Co-parenting is unconventional, but becoming like, it was just another way of building a
Hmm.
family. So being
Absolutely.
creative, right? Being in the
Yeah.
creative.
Seeing that this openness rather than closedness, there's nothing like a journey of infertility or PCOS or anything to make you feel
Right.
very isolated. And honestly, it's it we kind there's a part of us that does it out of protection, right? We kind of do it to ourselves. We kind of dam up ourselves because we feel unsafe. We feel that we have to kind of close off in order to protect our hearts because our hearts have been hurt. And unfortunately,
Mhm.
what that does is it closes us off to all the things, all the connection, all the love. And so being like kind of what you said, having courage to, in the face of fear, to share your story just opens up this opportunity for connection with other
Mhm.
people that would have maybe never happened had you not. It also inspires other people by you sharing your story, me sharing my story, all these other people on the summit that have shared their personal stories and struggles through fertility and
Right.
health and it's like by us doing that, we do kind of inherently, like you said, give people permission
Mhm.
to also be open and share. And suddenly you've
And
created this ripple effect. It's beautiful.
yeah, to giving them permission to have a story that has a happy
Ooh.
ending.
Yeah.
And like the stuff, the way that it unfolds is like the building part of the
Hmm.
chapters that
Yeah.
lead to the end. And I should say, not everybody is going to have the happy ending of the baby that's their
Right.
genetics that carries in their womb and
Right.
stuff, but there are ways of, whoa, sorry, I just kicked the table. Um, there are ways of getting to motherhood that
Hmm.
might not be ideal, but then is also very much part of the story.
Hmm.
My story shifted the day that I picked up a brochure about foster adopting, because I thought, well, I'm not in a
Hmm.
relationship, but I'm really good at giving pep talks. So maybe I should foster adopt a teenage girl and
Hmm.
help her heal her heart following like sexual trauma or whatever it is.
Hmm.
And then I can practice my grief skills by letting her go and all of that. And I guess the universe said, okay, Danica, that's enough. Like you got there, you're selfless enough, and let's
But you
see if
did
you're willing.
right. You opened up the possibility and instead of like limiting and saying it has to be this way, you let
Right.
it was like almost like you letting the universe come in and say, well, hey, guess what? I've got your back. I've got,
Mm,
I just that releasing, that surrender. There's kind of this surrender moment where you say, you know what? Life doesn't look the way that I thought it was going to, but grieving that story, letting that story go and seeing
mm,
that there's a lot here that is a possibility. It opens up so many more possibilities in your life. And you do really kind of feel at peace at that point. And that's something that's
Right.
really,
And
really,
that is a fertile moment, right?
yes,
That's a pivot point.
it is.
Mhm.
It is for sure.
And inside the Seed program, I teach that feeling as embodying the spirit of a mother, which
Mm-hmm.
is compassionate, which is patient, which
Mm-hmm.
is unconditionally able to love, and um, all the good things, able to nurture. And so I help the women see where they're already accessing the spirit of a mother by
Mm-hmm.
nurturing coworkers or keeping growing plants, or
Mm-hmm.
um, really there for a family member or somebody.
Yeah.
And that right there is another indirect way of giving them permission to think, okay, I am able to mother, so if
Mm-hmm.
I'm given a child, like, I can do it, instead of being
Mm-hmm.
afraid that I'm somehow inadequate, not enough, not
Yeah.
doing enough or whatever. So it's good for them to remember
Even
or to
having
realize.
the opportunity to mother yourself through this,
Yeah.
especially in that nurturing, practicing that nurturing, because I feel like there's so many of us that grow up that maybe didn't have that experience. And so we come to the space where we know in our minds we want to have a child, but we might be afraid to be a mother. We might be afraid of what that's going to look like for us. Are we even capable of doing that? And
Right.
so giving yourself this opportunity to practice that, the nurturing, that patience and things with yourself, with your partner, with a pet, with a plant, with a project or anything. I mean, that is such an amazing opportunity that you give yourself to practice
Mhm.
that. So, well,
Mm.
this has been absolutely phenomenal conversation, Danica, and I'm sure we could
Oh,
talk
thank
for
you.
hours.
Oh, yeah.
But I know that you have so many people to take care of. So I'd love to talk for a minute about what your gift is. You are gifting some fantastic things to everybody here that's at the summit. You have a
Mhm.
fertile thoughts meditation that's free for everybody to access, and I'll have the link for that. Uh,
Can I talk
Dr.
about that?
Yeah,
It,
yeah,
it's
absolutely. Please.
um,
Yes.
I think it's like 20 minutes long.
Okay.
And instead of everybody thinking, oh, I need to start thinking more positive, or they'll say, oh, I know, I just need to think more positive. But how do we do that? Right.
Mhm.
So moving the neurons from that place of like, this never works, over into, well, maybe it can or will one day, something like that,
Mhm.
involves some shifting of the neurons, the brain cells. So it's a 20-minute meditation that I created and produced myself with some binaural beats laid in the back.
Beautiful.
So it's a really nice music. And women don't need to be sitting in a lotus position and have incense burning and put their puja table and the whole nine. They can stream it in the car.
Mhm.
It's not going to make them fall asleep at the wheel. It's not hypnosis. It's just a meditation that's going to
Mhm.
work like subliminally to start
Mhm.
redirecting the thoughts. And I think changing some of the biology by
Mm.
working on a subtle subconscious level
Mhm.
that actually, fertility is my birthright, or
Mhm.
motherhood is part of my destiny. And I don't even say those two lines in the meditation. It's just
Yeah.
very, very innocuous. It's not saying like, now I'm holding my baby. It's just like,
Mhm.
it's unexpected, but pretty cool. The women
It
really like it.
sounds
That's
it
there's in the Seed program, there's 12 meditations, and Fertile Thoughts is the favorite one. So that's the one we're giving as a gift to your summit listeners.
that is so amazing, and it sounds phenomenal, and I'm sure there's going to be so many people that are going to benefit from that. On
Hope
top
so.
of that, you are also offering a discount to your services. Would you like to talk about that?
Sure. So inside the Seed program, we have a master class that's got the daily guidance, wisdom, food, meditations, movies, um, all the things, some men's program, IVF, step by step. And yeah, that's the big one. And then we have an endometriosis course, because there's so
Hmm.
many women out there with PCO
You also
that
have
are and
endo.
have endo.
Hmm.
And so it's called a holistic guide to healing endometriosis. And it's got 10 really awesome interviews in there from the leading world surgeons and some of the
Mm.
leading fertility specialists, like how they know to diagnose endo without doing the surgery. Like, what makes them think, oh, she's probably an endo girl? So there's that. And then there's egg freezing, which might be appropriate for some of the women with PCO.
Absolutely.
Right? Like, so they may recruit a bunch of eggs, but we want them to be good eggs. with recruit a bunch of follicles, but we want them to be having eggs inside, right?
Yes.
That can mature. So that program talks about patient empowerment and them doing it for insurance. And then the final course is healing after loss, which talks about the loss of the dream as well as the lost pregnancies. And since we're in the post-COVID era, there were a lot of miscarriages that happened during that very stressful time, and all of the uncertainty. The uterine linings would suddenly just thin out for no reason. And so I think there's something for everybody in there. And my offering is 20% off with the promo code SUMMIT20. And that applies to any of those 4 courses. So I hope the listeners find what they need in those programs.
That is an amazing offering, and so grateful that you are doing that, because it's that I'm sure that there's going to be something in there for everybody to take a look at. So please make sure you click on their links. If you'd like to get a hold of Danica, what's the best way for listeners to get a hold of you if they want to speak with you directly?
I like to receive emails through Danica, DANICA, Danica at seedfertility.com. That goes straight to my phone.
Excellent. I'll make sure that there's a link to that as well.
Yeah. And I answer all those emails myself.
Okay, fantastic. Well, this has been an absolute pleasure. I would love to leave our listeners with one last little nugget of wisdom from you. So what is one little inspirational piece of insight that you could give to a woman with PCOS who's struggling with her fertility right now, to help her kind of bring her back to joy and hope right this moment?
I would probably say because it's such a disorder that happens from an imbalance in hormones. So I would say, why don't you take a few minutes today and ask yourself, honestly, where might the imbalance lie? Is it creative and like ignoring that piece, or is it too much sugar or stimulants like coffee drinks and things, like, because that gets us out of balance, like similar to what you said in the military. How about being just in the world and being like task driven and just like stimulated on frappuccinos or whatever, because that's an environmental thing, as is PCOS, which says like something really wrong with women that have PCOS, that we're a product of the environment and the society and the culture that we're living in, where there's a Starbucks or coffee house and all this all over the place. But now we have these fertility centers also like all over the place too. So it's evolution kind of unfolding this way. So really give yourselves permission, ladies, to look at it from a bigger perspective than just, it's not working, this will never change, and it doesn't ever change, and so why would it change? Well, because like, start moving the dominoes in another direction. Line them up differently.
There you go. I absolutely love that. Well, thank you, Danica. It's been an absolute pleasure, and I'm so grateful you were able to be a part of this summit, and it has been a wonderful conversation, and we will talk soon.
Thank you. I hope so.